From WNYT, Albany, in HD. This is Forum 13.
Good morning. I'm Phil Bailey. Thanks for joining us on Forum 13. Really interesting show today. We're going to start by talking about, well, you know, the face of high school sports is really changing. A lot of concerns about injuries suffered in the sports our children play. On the other hand, there may be more masters athletes or grown-up weekend warriors than ever. We are joined by Dr. Gerald Ortiz, an orthopedic surgeon with St. Mary's Healthcare in Amsterdam, and Carla Pasquarelli, the coordinator of athletic training services there. Thank you both for joining us this morning.
Thank you for having us.
Let's start with the youngsters. Are the number of sports-related injuries increasing among young people?
Yeah, I mean, even with us, we were mentioning earlier in our conversation, the number of kids I've seen this year has doubled. I mean, at one of our high schools, we're already 100 less than we were last year. So we saw 1,300 kids.
Whole year.
Yeah, 1,300 kids all last year, and through 3 months this sports season, we've seen 1,200. So,
is the severity of the injury changing?
I think so.
There's no question that kids are playing more and they're playing harder, and the games are getting faster. I think the competition level has probably elevated for that reason, and just the sheer number of hours that kids are playing one or another sport is just increasing.
Another aspect, when I was in high school in the 1970s, there were very few opportunities for women, whereas now there are a great number of opportunities for women. So I would expect the number of injuries among young women to be skyrocketing.
No question about it. I mean, that's the one thing that we've found is that not only are there more injuries amongst women just because of the sheer number of hours that they're playing, but we've also found that women, young girls in particular, are more prone to injury than boys are.
Interesting. Is that musculature at that age, and not just, over the generations, young men have been driven into the weight room a heck of a lot more than young women? Is it just the musculature aspect at that age?
It's definitely a physiological issue. The females, especially with knee injuries, have an anatomy that predisposes them to injuries of the knee more so than boys.
Yeah. Okay, it isn't an orthopedic problem, as far as I know, but let's address it, move on. The diagnosis of concussions has changed dramatically, correct?
Yes.
That's right.
We're seeing an increase in it, and, it's more awareness. Everybody says, well, are we actually seeing more, or it's more education? We're getting out there, we're getting the word out, we're just letting the parents know, we're letting the kids know, we're letting the coaches know. These are the signs and symptoms you need to be aware of. If you see an athlete get hit and they smack their head off the ground, or they take a forceful blow to the body and their head whips back, we need to start looking at, are they showing these signs and symptoms? And that's how we're getting more diagnosis of them. But we're being a little more cautious about how we treat them now, too.
And, pardon the pun, but I mean, football appears to be taking a big hit. Is it too soon to tell if we're starting to see a shift in what sports children might be playing, young people might be playing in coming years?
I think so.
I think that's true, yeah.
Yeah.
There's going to be a shift, I believe. It might be early to say, but, football, obviously, it's an American sport. Soccer, the sheer number of kids playing soccer now and the leagues that go throughout the year are certainly increasing, but you may see a shift away from some of the traditional sports.
So, from football to soccer?
Correct.
For example. So you heard it here first. In about 15 years, we're going to have a heck of a U.S. World Cup soccer team.
Yes.
That's the hope.
In the realm of all school-related sports injuries, including orthopedic, the blown knee, the broken ankle, are we suffering more of them, or are we operating on more of them? In that 30 years ago, I think it's safe to, the ACL was a career-ending injury.
That's correct. No, there's no question that we're certainly more aggressive with our treatment. We understand the natural history of the untreated ACL injury and how much damage that can produce going forward. And I think that I don't know that there's an orthopedic surgeon out there who wouldn't recommend surgery for a young athlete with an ACL tear, as opposed to 30 years ago our treatments weren't as minimally invasive, and certainly the recovery was not as guaranteed as it is now. Not that there's any guarantees.
Right. But now, instead of a career-ending injury like Gale Sayers, a Hall of Fame football player, suffered, you have Peekaboo Street, Lindsey Vonn getting back on their skis on a new ACL and competing at the highest level on the World Cup and the Olympics.
Correct.
Yeah. How many ACL knee surgeries do you think? Can you compare how many were being done in the 1970s to now?
I would say that it's probably increased by at least tenfold. I mean, there's no question that the number of injuries we see every year increases, and the statistic escapes me, but certainly the number of surgeries that we're doing because of the techniques have improved over the years has increased dramatically.
And the ACL used to be a kind of a gruesome surgery, right, and recovery.
That's correct.
And now it's not.
That's right.
Yeah. If parents are rethinking whether allowing their children to play sports or what direction to play them in, or what sports to play, is it kind of ironic because right now it seems there are more 40-year-olds, 50-year-olds, and 60-year-olds competing in sports than probably ever, right?
Yeah.
Absolutely.
I mean, I remember when I used to work as an intern for the Empire State Games, the number of older athletes that they would have there. And it's impressive that you have this older generation still competing, and sometimes they're even more competitive than our younger athletes.
And when you're talking about surgeries that you perform, what do you think? What percentage do you think are, we'll call them masters, competitors, somebody past college eligibility?
Oh, it's certainly on the rise. I mean, I think in the past we used to look at somebody's age and say, okay, you're not really a candidate for this ACL surgery. But now if the patient is active, and especially with the ACL involved in twisting and cutting sports, or simply having symptoms of instability on a daily basis, there's no question that we're offering 65-year-olds ACL surgery, which in the past, that was reserved for 20-year-olds.
You ask them, what do you want to do with your life? What is your lifestyle? What lifestyle do you desire beyond this point?
Absolutely.
If they say I want full mobility, I would like to play basketball,
then they're a candidate.
Yeah.
And the techniques again have come so far that, and the rehabilitation has come so far that it's really not a huge issue.
And thinking in orthopedics has really changed, hasn't it? It used to be, doctor, it doesn't feel when I do this, and you'd say, don't do that. But now it's, well, I can make it feel better when you do that.
That's correct.
Yeah. More medicine across the board coming along to the thinking of sports medicine, what you guys have been doing the whole time?
Well, I think we all appreciate and understand the value of staying active into our later years, and there's no question that if someone's limited and we can help them, then we're offering the best that technology has and the best that our surgical skills can offer. Why not?
So, what is the point to take away here? Our masters, our older athletes, worse off because they're going to get injured by the wear and tear on their bodies, or better off because they may get injured, but they're fit, they're staying fit, they have goals to attain to stay competitive?
I think they're at that advantage. I mean, we tell even our younger athletes, we got to make sure you're fit before surgery, so they have a better chance of recovery. So it's kind of the same principle with the older population. If you're fit, you're going to get through surgery just fine. Yes,
there's no question that we don't heal as well as we used to when you get to the older ages, but there's no question that the patients with the techniques that we have today and with the therapy that we have today can get back to their active lifestyles without undue risk. And that's what it's all about.
Our normal reaction is to respond to, say, an injury or crisis by modifying behavior or modifying equipment. For example, we used to have a lot of ankle injuries, ankle breaks in skiing, so we moved the boot up higher and made it firmer. Now we have a lot of knee injuries. Are you seeing the kinds of injuries change over the years?
I think it's been over the last, say, 10 or 15 years when I've been in practice, I think that there hasn't been a whole lot in terms of technological advancements that have prevented injuries. We see non-contact ACL injuries in soccer and in basketball as much as we do in football. Of course, the contact in football is more rampant, although Carla may disagree with soccer. But there's, I don't see anything that is the panacea for all of these injuries. It's just something that, as Carla said, training, conditioning, and now some of the prevention programs that we have out there may offer the competitive athlete a little bit of an edge, but nothing that technology has to offer yet.
Is that the best preventative, or are there others to injury? Weight training, conditioning?
Well, you know, you throw in proper equipment too. They all play a part, you know, an equal part. You know, I always joke with the kids, they'll get taped before the game on Friday night, but they don't tape all practice. And it's like, well, you're working harder in practice. Why aren't we, you know, trying to prevent this from happening? Because you have more contact hours of practice, and they don't understand the whole philosophy behind it. But you know, we tell them, if you do the proper preventative techniques we're teaching you, you know, you won't have to tape come Friday night.
Is there a, because you hear this sometimes referred to, a rule of thumb when you can really work hard in the weight room? Is there an age when it's too young?
Well, what we found is that there was a, we'll call it a wives' tale, or a perception that if a young athlete who hadn't reached their growth spurt yet hit the weights, they would stunt their growth or ruin their growth plates. We found that that's not true anymore, but the gains that a prepubescent athlete makes in the weight room are really not that great. So the question is whether it's worth it. I mean, there's no question that strength can be gained, but muscle mass isn't going to be gained. We know it's not harmful, but it's good habit. It's good to have good techniques, and there's some evidence that suggests that, especially with some of the girls that tend to land with their knees turned in, that by training them to land from a jump properly, we can prevent some of these non-contact injuries by balancing their muscles better, because they tend to be more dominant in their quadriceps, that we can perhaps prevent some of these injuries. And just, again, in general, conditioning them better with agility exercises, what they call plyometrics, all things that are sort of sport-specific. Definitely, we're going to see, hopefully, evidence that this is going to prevent future injuries.
So you're talking about there is more science to this than they may realize.
Correct.
I spent time with the weight trainer at for the U.S. ski team, or one of them, a number of years ago, and so we go through the workout, and there were so many strengthening exercises for the arms and shoulders. And I said, why is that when, you know, ski racing largely is, you know, a lower body and a core?
Correct.
And he says, listen, we know you're going to crash at high speed and you're going to land on your shoulders. We don't want a broken shoulder to knock you out for the season.
That's right. Absolutely.
So what's the best rule of thumb here? If parents are discussing whether or not to let their children play certain sports, what should they take into consideration?
I think with any sport, I mean, it always carries that inherent risk of injury. I mean, I can tell you, I see it across every sport that we cover. You know, it's just kind of more a comfort thing. If you have a good coach who's teaching the athletes the proper techniques and, you know, getting them in the weight room and getting them stronger, I don't think it really matters what sport you play as long as you're doing it the right way. I mean, like I said, every sport carries an inherent risk.
Doctor?
I agree. I mean, I think one of the things that we've learned is that, again, preseason conditioning makes sense, proper technique during the season, but especially the younger athletes, I think it's pretty clear that they should at least take one season off a year to recover, to have some balance, and perhaps cross-train. We find that, especially in baseball with the young athletes, that the overuse injuries are dramatically increased by playing all year round. And I think the same would go for the other sports as well, and just having a good balance and trying to focus on technique, as Carla said, is probably the most important thing that we can take away.
All right, Dr. Gerald Ortiz and Carla Pasquarelli with St. Mary's Healthcare in Amsterdam. Thank you both
Thank you
very much for joining us.